There's a huge amount of information that's captured in the data that's collected throughout the course of clinical care. We have electronic health records now that are recording information about patients and decisions that are being made, their symptoms, their outcomes. These are all captured in digital form. So with Peter Mac, we've been working on trying to use those technologies to help extract information from clinical texts, specifically reports like histopathology reports and CT scan reports and so on.
The premise for this project was to assist with identifying these infections because they're rare. So one of these infections is fungal infections. These you might have heard during the COVID outbreak, the black molds, aspergillus, and these mold infections are very serious. They have high morbidity. They also impact their cancer care. So what we were wanting to do was to develop some assistive technology to help us find these patients.
So what we did was build a tool that can scan through the words and the language in the reports and really understand what evidence there is, what descriptors there are in those reports that tell us whether or not a patient may have one of these infections. We have a diverse team of clinicians, data scientists, software developers that are all coming together to build a solution. We need the clinicians to help us define the problem, understand the clinical data, the clinical characteristics of the problem. We need the data scientists to model and build the technical solutions that allow us to transform that data into information. And we need a team of software developers that can help us actually implement and integrate that technology into a real-world system, which is then shared with clinicians through a user interface.
There is no question that we need to be leveraging and bringing artificial intelligence into our healthcare. Our patients expect it, as do our clinicians. The important thing, though, is to recognise that both patients and clinicians need to trust what we're building. And so the way that we have gone about this project is to ensure that there is trust and that it is assistive technology rather than making decisions for them.
I'm really excited that the work that we're doing in a kind of data science laboratory is going to have real-world impact. It's going to be used by the clinicians to help them understand the patterns of infection that are happening, the burden of infection that's happening within the hospital, and give them a tool to really help navigate the complexities of complex patient care.